Urinary incontinence is defined as the involuntary loss of urine through the urethra outside of urination, without a prior sensation of the need to urinate. It's a common condition, particularly in women over 50 years old, with a clear female predominance. However, it also affects men, although less frequently. It has major impacts on the daily and social life of affected individuals. It can lead to hygiene problems, social isolation, and a significant decrease in quality of life. The diagnosis is primarily based on a detailed patient history and clinical examination. Stress urinary incontinence, SUI, mainly results from an impairment of the urethral support and closure mechanisms, which are essential for maintaining continence. Two main mechanisms can be involved, often in combination. Hammock failure. The supporting structures, including ligaments and pelvic floor muscles, play an important role in maintaining urethrovesical alignment. Failure of these structures leads to urethral hypermobility and malposition, causing the urethra to be displaced outside the abdominal cavity, resulting in cervicocystoptosis. This displacement compromises the closure mechanism, particularly during exertion. Sphincter insufficiency. When the internal or external urethral sphincter is deficient, it is no longer able to maintain sufficient pressure to resist increases in abdominal pressure. There are factors that predispose to the development of this urinary incontinence by weakening the support structures or disrupting the continence mechanism. Age. With aging, connective and muscular tissues lose elasticity and strength, reducing the effectiveness of support mechanisms. Menopause. The decrease in estrogen during this period leads to thinning and fragility of urogenital tissues, worsening incontinence. Obesity. Excess weight exerts chronic increased pressure on pelvic structures, raising the risk of dysfunction. Multiparity and dystocic deliveries. Multiple pregnancies and difficult deliveries, particularly those requiring instruments such as forceps, cause trauma to pelvic structures, promoting damage to support mechanisms. Pelvic surgical interventions such as hysterectomy can alter the ligaments and pelvic floor muscles. Intense practice of certain sports, especially those involving repetitive exertion or high-impact activities like gymnastics, can gradually weaken the pelvic floor.